From its upbringing as a Spanish colony to the gold rush and to the modern day tech hub, the San Francisco Bay Area is a wide and diverse place. It's home to over 6 million people, many of which are used to spending much of their time outside due to exceptional weather, hiking trails, beaches, and sightseeing. Cities like San Francisco also have a high population density at 17,160 per square mile, as compared to Houston's 3,600 and LA's 7,000. As a major city on the coast in the United States, San Francisco also gets millions of international visitors every single year. All of this seems like a recipe for disaster for when COVID struck. And yet, disaster didn't come. San Francisco has had one of the lowest case rates of the major cities in the US. While New York spiraled out of control over summer 2020, San Francisco had one of the lowest death rates. Currently, Los Angeles is experiencing a massive outbreak, yet San Francisco still has one of the lowest case rates of the major cities. Why is a place with billionaires and homeless people walking on the same streets avoided thousands of deaths? Well, it's because they've had experience. Let's go back to 1981. A rare lung infection called Pneumocystis carinii pneumonia was found in 5 previously healthy gay men in Los Angeles. There were also reports of groups of men in both New York and California who had an unusually aggressive cancer called Kaposi sarcoma. On July 1st, UCSF's Paul Volberding saw his first patient with Kaposi sarcoma. This would be the start of the AIDS epidemic in San Francisco. They just didn't know it yet. By the end of that year, 270 cases were reported with severe immune deficiency among gay men, and 121 of them had died. In 1982, a group of cases among gay men suggested that the disease is sexual in nature. People started to assume that this disease only affects gay people. However, with the first infant case discovered, people realized that this was an infectious disease that could be infected through contaminated blood. Later that year, the CDC coined the term Acquired Immune Deficiency Syndrome, or AIDS, which encompassed cases like drug users. However, the perception of AIDS being a gay disease stuck. People thought of AIDS as punishment for being gay. Patients were ostracized if they had the disease. Many were the subject of homophobic attacks and exclusion. For example, Ryan White, a teenager from Indiana, was barred from school after he was diagnosed with AIDS. Individuals such as Ryan were socially dead, not given the respect of a living person, and considered and treated as dead while they were still alive. As a result, individuals were losing their will to live and taking their own life. Tackling this epidemic was going to take more than just treating the disease itself. Not only would health professionals have to treat the biological side of the disease, it would have to treat the psychosocial aspects as well. In response, San Francisco hospitals, the SF AIDS Foundation, and the city and county of San Francisco, with the help of others, developed the San Francisco Model of Care. This emphasized home and community-based services which addressed multiple needs such as self-care, residential care, special care for dying, employment counseling, and special care from abuse. Not only did this approach help, but it strengthened ties between the city public health department, local hospitals, and community groups. An extensive public outreach also created trust between the marginalized groups that they helped and public health officials. Although COVID and HIV/AIDS are different in many ways, Dr. Monica Gandhi sees similarities. In her words, both are social diseases caused by an RNA virus and both have disproportionately affected marginalized groups. And the handling of the AIDS epidemic has definitely affected the city's response. San Francisco has made data-driven calls. SF was one of the first places to go under lockdown back in March 2020. Bay Area CEOs were quick to tell workers to stay home. However, this is easier for computer science and tech workers rather than those working in factories and mines. San Francisco residents also have a pretty good appreciation and belief in science, and thus the masking rate has been pretty high compared to other cities. However, overall, it was the collaboration that truly helped to control the disease. Cooperation and sharing between private and public systems assured that all hospitals were prepared. Excellent contact tracing programs were launched, which allowed for COVID to be traced well. Doctors at UCSF serve on a COVID-19 advisory board, which has weekly calls with the public health department that helps to determine the city's COVID response. This collaboration allowed for unique projects to get done. COVID has been primarily affecting marginalized communities as they typically don't have the funds to just stay at home. Dr. Diana Havler, doctor at UCSF, was able to reach out to the city's Latino task force on COVID and Grant Colfax, the director of the public health department. Together, they were able to do a campaign which tests thousands of residents in the Mission District, a primarily Latino community. This testing campaign was able to connect individuals who tested positive with medical care, food assistance, and other services so that they could properly self-isolate. And as a result of that study, Supervisor Hillary Ronen launched the Right to Recover program, which guarantees up to 4 weeks of paid wages to anyone who tests positive and does not have alternative income or benefits during their recovery period. So, what could other cities learn from San Francisco? Well, invest in those impacted the most and foster collaboration between the local government, major healthcare institutions, and the residents of the city itself. Thank you so much for watching this video. If you liked it, be sure to hit the like and subscribe buttons as I'm going to be releasing much more content over the next couple of weeks. So with that, be sure to wear a mask and I'll see y'all in the next one.